A new study presents a troubling revelation about the possible origins of Alzheimer's disease, suggesting that the bacteria responsible for gum disease may be a key factor in the development of this devastating condition. The findings point to a direct connection between oral health and neurodegeneration, with evidence that Porphyromonas gingivalis, the bacteria linked to chronic gum infections, can infiltrate the brain and contribute to the buildup of toxic proteins associated with Alzheimer's. This alarming discovery raises serious concerns about how an infection that starts in the mouth could potentially trigger irreversible damage in the brain, leading to cognitive decline, memory loss, and ultimately dementia. What makes this finding particularly concerning is how common gum disease is. Many people suffer from gingivitis or periodontitis without realizing the potential long-term consequences beyond their dental health. While oral infections have long been associated with inflammation and cardiovascular disease, the idea that bacteria from the mouth could play a direct role in Alzheimer's adds a new layer of urgency to an already widespread issue. The study found that these bacteria not only enter the bloodstream through inflamed gums, but can also cross the blood-brain barrier, a protective shield that typically prevents harmful substances from entering the brain. Once inside, the bacteria release toxins known as gingipains, which contribute to the destruction of brain cells and the accumulation of beta-amyloid plaques, one of the key hallmarks of Alzheimer's disease. This connection between gum disease and Alzheimer's is particularly alarming because it suggests that millions of people may be unknowingly increasing their risk of developing dementia simply by neglecting their oral health. Unlike other risk factors such as genetics, which are largely beyond an individual's control, gum disease is preventable with proper hygiene and dental care. However, many people fail to take oral health seriously, dismissing bleeding gums or bad breath as minor inconveniences rather than warning signs of a deeper, potentially life-threatening issue. The fact that bacteria from an oral infection could lead to brain damage highlights a dangerous underestimation of the impact of gum disease on overall health. The implications of this research are unsettling because they suggest that Alzheimer's may not solely be a disease of aging or genetics, but one that could be triggered by chronic bacterial infections over time. If an infection in the mouth can lead to neurodegeneration, then the very definition of Alzheimer's may need to be reconsidered, shifting the focus from brain-specific mechanisms to systemic health factors. This raises difficult questions about how many cases of Alzheimer's could have been prevented through better oral care and whether current approaches to treating the disease are overlooking a crucial piece of the puzzle. Another deeply troubling aspect of this discovery is that it suggests Alzheimer's could be developing long before any symptoms appear, driven by low-level chronic infections that go unnoticed for decades. This means that by the time cognitive symptoms become evident, the damage may already be extensive, making treatment far more difficult. The idea that a disease as complex and devastating as Alzheimer's could have its roots in something as seemingly unrelated as oral bacteria forces a reevaluation of how early interventions should be approached. If gum disease is indeed a major contributor, then routine dental care and better public awareness about oral hygiene could be essential tools in reducing Alzheimer's risk. The findings also highlight a significant failure in healthcare systems that often treat the brain and the rest of the body as separate entities. Dentists and neurologists rarely work together, and oral health is often treated as a secondary concern rather than an integral part of overall well-being. This research suggests that ignoring dental health could have far-reaching consequences, making it critical for medical professionals to integrate oral care into broader healthcare strategies. The possibility that something as preventable as gum disease could be fueling a global crisis in neurodegeneration is a sobering realization that demands immediate attention. The notion that Alzheimer's could be, at least in part, an infectious disease caused by bacteria that thrive in poor oral conditions is a stark warning about the hidden dangers of neglecting dental health. It raises the disturbing possibility that millions of people could be unknowingly accelerating their own cognitive decline simply by not taking better care of their teeth and gums. If further research confirms this connection, then failing to prioritize oral hygiene could be seen as a major public health oversight with devastating consequences. The modern approach to Alzheimer's, which focuses largely on treating symptoms after they arise, may need to shift toward a more preventative strategy, one that recognizes the role of chronic infections in shaping long-term brain health. This research paints a grim picture of how a seemingly minor health issue can have catastrophic consequences if left unaddressed. If bacteria from gum disease can indeed infiltrate the brain and trigger Alzheimer's, then millions of people may be at risk without realizing it. The idea that a preventable oral infection could contribute to one of the most feared diseases of aging is a disturbing thought, but it also offers a crucial warning. Failing to take oral health seriously could have far more severe consequences than anyone previously imagined.